All right. We are almost done. We have a couple more sessions, but this panel topic is, as Sumaira said, extremely important to the Sumaira Foundation. It is also very important to SRNA. Both organizations are making strides forward to do a lot of work in this topic, diversity, equity, and inclusion. And as Sumaira said, I recently started working with TSF, and I can say personally that Sumaira has been very intentional in trying to bring on a diverse group of women and men, Michael, who not only are very skilled at what they do, but really represent diverse backgrounds and bring valuable insight and knowledge to TSF. At the end of the day, NMOSD and MOGAD affects all races, all genders, people of all identities. It does not see any of that. And so we have to do everything we can and go above and beyond to really make sure that ultimately we're addressing the unmet needs and challenges of all people, because that's who we're serving, is everybody. So our discussions today will really focus on the challenges and unmet needs of people who represent diverse backgrounds when they're navigating the healthcare system. We were supposed to have one other person on our panel today, but everybody here really doesn't need an introduction. They've all spoken. So Sumaira, living with NMOSD, Avery, living with MOGAD, and Paula, who is somebody who treats people living with NMOSD and MOGAD, and really, as you've seen earlier today, is a tremendous partner and help with people. So thank you all for being here. All right, so Sumaira and Avery, first of all, it's really, really inspiring to hear from all of you. I mean, the patient panels were just amazing. You know, you can really never hear enough patient stories because, as Dr. Greenberg said as well, every time you meet a patient, you just learn something new. So kind of tell us, you know, you both have your own organizations, you both live with and navigate the diseases, and you can really speak to what you deal with personally, but also speak on behalf of the people that you serve. And you're also both women of color, you come from rich cultures and backgrounds. So tell us, you know, when somebody like you is navigating the healthcare system, what challenges may they face when they're you know, trying to seek a diagnosis, go through the healthcare system, just by being somebody who is a certain identity? Can you speak either on your own personal journeys or maybe on behalf of your patient community? So, Sumaira, I'll start with you.
I was going to say, can Avery go first?
I was going to say no, thank you.
First of all, it's really nice to now be a panelist. It's a nice change from the rest of the day, but I just want to start by saying that I am incredibly proud to be a child of immigrants and a woman of color and a patient with a rare disease. So I kind of check off a lot of different diverse check boxes. And to be the founder and executive director of this foundation, which I agree, we're so proud to be so diverse. For full transparency, I have to say that me personally, I have never experienced any issues really with getting diagnosed or getting access to therapies, and I think that's by virtue of the fact that I was already working in the healthcare system in Boston, and so I knew how to navigate everything. So I feel very, very fortunate that I didn't have to. However, in my role as an advocate, I hear stories, horror stories, all the time, and it is truly heartbreaking. I hear stories of patients not being taken seriously or being medically gaslit because of, you know, the color of their skin, or maybe their education level, or, you know, their financial status, or being from a rural neighborhood as opposed to a cosmopolitan area. And for me, hearing these stories just gives me more ammunition as an organization leader to do more to actually address these issues, because as I said earlier, no one ever asks to get sick. So if you are going to get sick, then you have to deal with having people not take you seriously, or not listen to you, or not get you the help that you need just because you're different. I mean, this is ludicrous to me. So I want to do whatever we can from an organizational perspective to not only listen to people from different communities, but also address these gaps, because to be totally frank, I just feel like, you hear diversity, equity, and inclusion everywhere to the point where it's kind of become a buzzword. But how do we really put our money, what is the expression? I'm so bad.
Money where your mouth is.
Money where our mouth is. And walk the talk and do what we need to do to accurately represent people from all different communities, from all different walks of life. So anecdotally, the only thing I can say is that I have had experiences in the emergency room where I was told that I was having a panic attack as opposed to actually having a relapse. And I think that was because I look normal and I'm just, I'm a young female. But in terms of, stories about people getting turned away because they're a different color, I hear this every day, unfortunately.
Yeah. Avery?
I think one of the first things that we kind of have to look at is what is the problem, and figuring out how we as advocates, as an organization, as pharma, how can we better represent people of color. I represent the LGBTQIA plus community as well as being a woman of color. So I feel like I personally have not had, like you said, there's horror stories of similar, like just the other day I was talking to somebody, it was two people, the exact same disease, different skin colors, exact same hospital, but they were taken completely different. So I think acknowledging that there is an issue with representation of Black and brown voices, and I think we have to then address how are we going to amplify those voices? What can we do as an organization? Something that my foundation, Couch Pennies, likes to focus on is the diseases that affect those populations, and amplifying those voices so that we are represented in clinical trials. Black people make up 38% of the population, yet 16% in clinical trials are people of color. So it's things like that that we need to be able to address. We need to be able to have open conversations about it. It's uncomfortable for a lot of people. They don't want to talk about race and racism and any other ism that there can be. And I think it starts within. So we were just talking last night about how we can better do that for the people that support us. And I think it definitely starts with inclusion boards like this and making sure that everybody has a chance to speak on their experience. And I think it's also important to note that my experience is not going to be the same as Sumaira's or yours or anybody else, because I think it is very different. And we do have to kind of acknowledge that fact.
Yeah, absolutely. And, when you think about patients, at the end of the day, we're all people, and every human being is different in their own way, what they like, how they respond to things, how they digest educational materials. If you go into a clinician's office, you want care and educational materials and communication tailored to you. And what speaks to you the most. So Paula, kind of based on what you just heard from Sumaira and Avery, how can healthcare providers and institutions really just improve their cultural competence to make sure that they actually are providing equitable care for all people?
That's a tough question, and I think there's different ways to answer it and look at it. I think where I start off is you have to actually be self-reflective of yourself. Yeah. I think it starts with me as the individual to say, am I treating the patient in front of me as another individual, or am I treating them as a person of color, a woman, or whatever, and really understanding their needs, their concerns, and not just labeling someone based on what a textbook or something else may say. I think everyone in this room has some type of implicit bias internally, and it's being open and willing to say, yes, when I see a person who looks like fill in the blank, I make a judgment. Because I think the first step is if you can identify that happens, then you are more aware, is my judgment then keeping me from providing additional information? And it could be across the board. If you feel a person is not as wealthy as another person, do you withhold certain information as far as the care because you say they may not afford it? Well, you don't know what resources a person may have, and you want to share everything's available. So I think it starts within, to be open and transparent to say we all think this way, Now, what are some tools or different things I can do to help myself make sure I am being fair and giving all information to all patients?
Yeah, yeah. And, I've worked in so many different disease states, and I've done a lot of moderating of panels. And, it's kind of rare that you have 4 women of color sitting on a panel. But, as you said, Avery, there is much larger representation when you think about who is impacted the most by certain diseases, and NMOSD impacts people disproportionately if you're a person of color, for example, and so I think there needs to just be a lot more done to not see this as, oh, this is a really unique thing, that, oh, Sumaira Foundation has a very diverse organization. No, it should just be that the Sumaira Foundation represents all people. It shouldn't be unique in that way. And so that goes along with just addressing the whole mistrust in the medical community. There's some biases by people, and we can talk about later the clinical trial issue. I think there's a lot that can be done to just tailor information about clinical trials differently to different people, because at the end of the day, again, as long as information is clear to people and they understand what they're getting into, they're going to feel more empowered to take part in that. So Paula, as I said, I come from a family of immigrants as well. And naturally, a lot of people in my family, when they are seeking healthcare from a doctor, my mom, for example, this doctor's Indian. He or she must understand exactly some of the things that I've been going through. And that's a very natural response. And so, Paula, can you talk to us about maybe some of the patients you see? Do they feel more comfortable speaking to you versus some other clinicians just because they may feel like they relate to you better?
Yes, I actually had a patient who shared that exact thought and concept with me. She was diagnosed with MS, and she was seeing one of the physicians, and the physician was telling her, okay, your next visit is going to be, so she stopped him, and she said, I want it to be with Paula. She said, representation matters. I think she will understand a lot more of different things I'm going through. I want my next appointment to be, and so she shared this with me, and I was just like, well, thank you, and I guess I am sensitive as being a African American woman. There are certain things just within my community I can resonate with better, but I also try to just learn from every patient that I see, because I think there is something I can learn from every patient to help whoever they may be, whatever they may identify as a way to empower them to speak up for themselves.
Yeah, yeah. And we see this in the medical community. There is a lack of diversity when it comes to the healthcare providers who are serving people. So this question is for everybody here. What do you think can be done to just increase diversity in the healthcare workforce? I mean, just across, for neuroimmunology, for example, I'm sure the stats are even higher in terms of just not enough people representing different cultures.
I will just share that I am in touch with many Black neurologists in this country who are equally as capable as, Caucasian neurologists. And they have shared with me that even they experience racism in the clinic, where there are patients who mistrust them because they're Black. And I'm like, what are you talking about? You went to med school, you did your residency, you did your fellowship. That's absurd to me. I think the fact that, this is even a thing, in my brain, it just doesn't register, because this is a doctor. It doesn't matter what skin color they are. They're just trying to provide you with care. So all this to say that, first of all, I think we need more Black neurologists. I think we need more color in neuroimmunology in general. And I think we need to, just as humans, stop paying so much attention to what color people's skin is.
Yeah, yeah, absolutely.
I think we also kind of then have to ask of our healthcare workers that are of color to step up, because we can't get there if we don't have that missing piece.
Yeah.
And as people, it's a natural thing to gravitate towards other people that are like you. And I feel trust would be instilled a lot better into the rare community if we had people that we looked like. And as unfortunate as it is, that's just how humans are. And so asking people of color, women, LGBTQIA, whatever, what have you, to step up and be kind of that guiding light and hope for people like myself, or people that have had worse experiences than I have, to be kind of that pillar that we need. So
I think it boils down to the recruitment and representation. So I went to PA school at UT Southwestern, and they have made it a really one of their mission statements to diversify their applicant pool, and have put a big push of really recruiting from more diverse backgrounds, and putting in front of students who are thinking of, what, should I become a doctor, should I become a PA, putting in front of them people of color who are in these positions, just because sometimes, even though I'm like, PAs have been around forever and everybody knows about the PA profession, there are still some people today who do not understand the role as a physician assistant and what does that mean. And so then when you get into more of different minority groups, then we had never been exposed to a PA. And so representation does matter, and it's making a conscious effort to get out to any and all qualified applicants for whatever medical pool to say, you can do this if this is what you want to do.
So just shifting gears. So Paula, I know UT Southwestern has a partnership with Parkland. Can you give some more insight into what that partnership is and what it's really done for people in need?
Yeah. So as Dr. Greenberg had said earlier, so Parkland is the county hospital. It's that catch-all safety hospital for all patients. So your lower socioeconomic status patients, patients without resources or insurance, what people would say, patients with high social determinants of health. And so what Dr. Tardo and Dr. Horton have really prided themselves doing is forming a true neuroimmunology clinic at Parkland to help those patients with other unique resources and needs. And then on the research front, what gets to be interesting, it's a unique research pool of patients to be able to recruit from. As you've hinted at, there's not many representation of people of color in research trials, but a lot of my patients are people of color, and so they'll come to me and say, I feel like my disease state is more severe than my Caucasian counterpart, and they could be right. And I don't have enough data to speak to those differences. I get a little annoyed when I have a person of color who said that they went through years of getting diagnosed, because especially on the MS side, because the textbooks say it's a 20 to 40-year-old European descent person, and they say hold on to that as the population that you look for multiple sclerosis. And we can all say that is changing. That is not the case. So I think the clinical trials and going to where those patient population are available and letting them know this is available for you to participate in, this is why it's important for you to participate in, so you can take better care of patients that look like you down the road.
Yeah, and I think, for example, with biotech companies, therapy makers who are in the clinical trial development process, I think it is so important to include individuals in that R&D life cycle from start to finish, to make sure that the clinical trials are really being designed to represent the needs of all people. And so, I know there's a lot more partnerships involved in that, and really we're kind of driven to a much more collaborative type of work ethic now when it comes to bringing therapies to market. So it's really encouraging to see, but obviously there's always room for improvement, and there's kind of a higher bar that we have to set there. So Sumaira and Avery, since you both run your own organizations, you care about this topic so much, tell us about what you're doing within your own organizations to address some of these challenges we're talking about right now.
I'll start. So something we started doing last year on social media was an Unknowingly Rare series, and that focuses on rare diseases that affect Black people. And just doing research, it's so hard to find data that represents that. And if there is, it'll be just on the bottom. So something we really want to emphasize on are those voices. Because the more people know that there is an issue with this and there is an inclusion issue, and understanding where the distrust and the lack of inclusion comes from, we really want to be able to be that kind of force for people to be able to express that, and just kind of showing people that there are diseases that affect certain minorities and people of color. And I think the more we recognize that, the better we are going to be able to help those populations.
I think from the TSF perspective, there are 3 things I can talk about to reinforce the importance of DE&I. The first is we have a global patient ambassador program. It's about to be 50 ambassadors next week. We're announcing our first ambassador from Kenya next week. And our ambassadors represent 16 countries across 5 continents. We are all different shapes, colors, sizes, different education levels, and just incredibly diverse. And this is so important because, as we all have said, representation really, really matters. And I want a patient from anywhere in the world to be able to look at our organization and our team and say, hey, I see someone who looks like me, or I see someone whose story is like me, or who has the same struggles as I do, or have some kind of commonality. I think that's incredibly important. The second thing is that we have been expanding globally over the last couple of years. And as we know, there are patients all over the world. I mean, these diseases do not discriminate in terms of race, creed, geography. Of course, there are places where it's far more prevalent, but we know that there are patients all over the world. So bringing TSF to the rest of the world means that patients everywhere will have access to knowledge, information, community support, and hopefully therapies very soon. I think that's really, really important, which is why we've also made our website available in 13 languages and hopefully more soon. And then the third, I guess I'm launching it here now. It's been a dream project of mine since 2018. I just didn't have the knowledge and the infrastructure to bring it to life until this year. But in 2023, we're launching the Coalition for Health Equity in NMOSD and MOGAD, and that is thanks to the support of Horizon and Genentech. This is going to be a commitment to diversity, equity, and inclusion in the form of bringing together stakeholders from our community, so that's patients, caregivers, advocates, clinicians, researchers from all the different backgrounds, listening to them, having difficult conversations, so that we can try to understand and assess what are the needs and what are things that we can actually do to impact these communities. Again, I don't want to be the organization that just says we're going to do something or just uses something as a buzzword because everybody's saying that they're involved in it. I want to walk the talk and help people because these are the communities that need the most help right now.
Yeah.
And I think it's really kind of special to have those inclusion boards. If you're a rare organization, that's something that you need to have. It's not kind of, it's a need now, because the more we go and the more we don't pay attention to those marginalized groups, we're setting them back. And that inclusion boards are going to be the conversations that we don't want to have, of course, but it's the conversations that we need to have. So
Yeah. And so, Sumaira, what was alluded to today was that the landscape of NMOSD and now MOGAD has really changed dramatically over the last 20 years. And Christine said, when she was first researching more information about what she was going through, there was very limited knowledge out there. Now, there's a lot of different organizations that are doing great work for NMOSD and MOGAD. What has been the most effective educational tools to empower people? Everybody kind of responds differently to things. There's videos, there's infographics, there's webinars. What has been the most used and implemented tool, would you say? And this is for everybody because you're in the midst of it.
social media.
I was just going to say the same. Social media. Social media has been a driving factor of all of this. I would say it to Mark Zuckerberg, whether you like him or not, that it's thanks to Facebook and Instagram that TSF is where it is today. This is the best and most effective, productive way to communicate and connect with the community all over the world. Now, that being said, as effective as social media is, we can't assume that everybody has social media. We can't assume that everybody has a smartphone or a computer. So I always, it actually keeps me awake at night. I'm like, what about the folks that don't have all of that? How do we get in touch with them? How do we get in touch with the people who aren't fortunate to be able to come to a patient day like today? They don't have access to, transportation to get here. They may be in a very, very rural place where electricity is even a factor. So we really have to start being creative and thinking about how to get in touch with those folks as well.
And kind of going back to the social media piece, don't prefer to read a bunch of medical jargon about what a disease is or something. So when I see an infographic that's simplistic and easy to understand and it addresses these kinds of issues, it's more appeasing, I feel like, because we don't want to sit and read. The attention span of the population is very quick. So getting the point across in a time efficient manner, social media has been a great tool. But like you said, how do we help those people that don't have social media? How can we still get resources and things like that to them?
I feel what my patients share to me is being able, whether it's through social media, whether it's through a patient day event such as this one, some way where they can come together to connect with other patients. That's where they truly will share that they have learned the most about their disease state. Not what I tell them in an office visit, not what they read, but really getting into the nuts and bolts with someone who is living with the same exact disease process they have. And it's like this unique bond that occurs of like, you get me when I say, I just sometimes feel like my legs won't go. My brain is saying legs go, but they just won't go. And so, yes, I can do a patient education, whether it's a PowerPoint or a webinar, and explain what's happening anatomically or physiologically, but just to be able to hear someone else say, I experienced that same thing, and this is how I navigate through it, I think is huge for the patient. So I would be one, of course I get social media is a way to do that, but just finding unique different ways of having these community to come together and let the patient share how to manage the disease.
Yeah. You know, Paula, UT Southwestern is very connected to the patient advocacy community, but there are so many institutions and clinicians out there who may not even know that these patient communities exist. So do you have some thoughts on how to get people thinking in that way? As soon as they have a patient with a condition, hey, let me find out if there's an organization to connect this patient to.
Well, I don't want to give credit to industry. I think this is the key part industry can play.
Yeah.
I think industry knows all the different neurologists, the different practices who are seeing these type of patients, and they can be that voice for the patient. If you're with Dr. So-and-so who's in a small area and they mention, hey, I now have this patient with this NMO stuff, what should I do? They can say, hey, you should get them plugged in with SRNA, TSF, all the different organizations, and give them that information. So I think that is a key role that industry can play for all the patients, is to be that unspoken voice for the other neurologists, different healthcare providers who may not know of the different resources of, here are some different ways you can help that patient.
Awesome. Thank you. All right. We have 2 minutes and 19 seconds. So any questions in the audience or even virtually? I see her standing. I just want to make sure there's nobody else in the audience. All right, here, go ahead.
Yeah, and if of course there are, we have mics for everyone in the room as well. So some questions from our friends online. What are the best techniques to break down the cultural barriers that may exist, either individually or as an organization?
That's a hard question.
Yeah, I don't know how to answer that.
Anybody?
I think, well, something
Yeah.
you touched on is since there is a problem with language and language being a barrier, having those resources available in several different languages, not just the 3 main ones you hear. Connecting to those communities and making sure that they have material that is understandable for them, I think is something we of course need to work on, but I think that's a good start, is making sure that's available.
I can give a good example of how we're starting to work on that. So we have support group meetings online now in multiple countries and multiple languages. And we launched one about 6 months ago in a country where we were very excited. We went in thinking it was going to be like all the other countries, and immediately we learned that, oh no, this is a different culture. People don't talk about these things. So how do you talk about things with people who don't talk about things? But what we're seeing now, 6 months later, we haven't given up, and it's about trust, and it's about loyalty, and it's about, as I said earlier, you look at a group and you're like, okay, initially I wasn't sure, but they look like me, they're from the same culture as me, and they're genuine, they're here, we all have the same disease. And so long story short, what we've seen happen in this particular group is that it has grown quite slowly over the last 6 months, but it has grown, and people are finally opening up because they feel that level of trust and comfort. So I think, especially for TSF, and Michael knows this very well, but as we expand globally, we have to go in with an open mind and an open heart into different markets, and realize and understand that humans in different places connect with each other differently, and they communicate very differently. So how do we adapt to those, different cultures as we go around the world?
Here, one more question.
Yeah, I have one more. I didn't know, Paula, if you had any. Okay, wonderful. The other question, Avery, it's related to something you brought up earlier. So Avery brought up a great point about representation. Where do we start in getting representation where it needs to be?
Excuse me, advocates. I think that's who we listen to the most. That's whose voice we hear the most. If you are somebody that is a part of, one of the communities we talked about, and you're comfortable with utilizing your voice, that's a start. Having more people that are open to that and open to having those hard conversations in public, I think is a great place to start. Secondly, making sure you have representation on your board.
Yeah.
Like I said, we gravitate to people that are like us, and when we see a board of people that doesn't look like us, why would we trust anything that they have to say? So it's important for inclusivity in all aspects, I think.
Jasmine already said this before, but I'll just articulate it once again. The fact that the four of us are up here on this stage as women and women of color from all different walks of life talking about this, I think is a great first step, and I'm proud of us.
I have a question for you, Sumaira. How can people that are not a part of these communities that we've talked about, how can they be of assistance, and how can they help make sure that all voices are heard, not just a single race?
Communicate with us. Tell us, we're here to listen. We're here to absorb and learn from everyone else. Dr. Greenberg earlier was talking about this opportunity he has with patients. He learns from them when he's with them. And similarly for advocacy, we learn from people when they communicate with us and they share with us what they want to share. So don't be shy, don't be afraid. This is what we're here for. We want to help people no matter where you are in the world, what language you speak, what color your skin is. But, I can't force people to say things. So I want people to feel empowered and inspired to come to us because this is what we're here for.
And I think a quote that I like to go off of is, when you pity someone, you disempower them. So we need to uplift those voices so we can empower people and make sure that when they share, they're not uncomfortable, or they feel like, oh, my experience doesn't really count because I didn't have it as bad as somebody else.
Absolutely. That's a perfect place to end. Thank you so much. This was a really insightful discussion.
Thank you.
All right.
Okay, so we're going to go to the next session, but I have to take a little break, so I'll be right back.